today what I'm going to be talking about is a knee problem. So when Holly squats, she's having pain all around this area. So most likely the knee problem is not just a knee problem. It's going to be a hip and an ankle, or both, or one or the other. So we're going to figure that out. I'm going to show you the analysis, and then I'm going to show you how to problem solve this problem. I'm going to stay in this region. You have to adjust the whole spine. I'm not going to do that for time's sake, and I want it to just be regional at this point. So, all right, so what I'm going to do first is I'm going to have her seated, I'm going to have her bend, and then I'm going to go through and check and adjust the hip if needed, and then I'm going to go to the femur joint, I'm going to go to the knee joint, and go to the ankle joint. I'm going to show you how to do all those things. Guys, what I want you to do is go under the PSIS, and I'm going to have Holly lean forward. And so if you see how that left side comes up, that's showing that there's a fixation in that SI joint, and most likely a fixation in that lumbar vertebrae. So I'm not going to go into the lumbar vertebrae. There's also most likely some other problems going on here, because typically if you have a problem here, you would most likely have ribs or thoracic spine or lumbar spine that needs to be adjusted. I'm not going to go into that in this video. But what I am going to do is I'm going to have Holly lay on your side this way. And so, all right, very good. And so what y'all are going to see is my hand placement. I'm not going to go over the actual side posture maneuver, because that would take a lot more detail. But I am going to adjust it and just show you. So Holly, let the shoulder go. All right, that was good. Okay, so what I'm going to have you do now is lay on your back. All right. So now what I'm going to do is the second part of that problem would be to check the femur joint. And so when you check the femur joint, we're going to go and we're going to scour that hip joint. And she has a little bit of adhesion right there. We're going to go all the way around, and we're going to just check the rest of that femur joint. So how I'm going to adjust that is, I could do it without the drop, but I'm going to use the drop. It's going to be a little loud, but it's very minimal impact to the patient and the doctor. Holly, move down just a tiny bit. That's good. All right, you're going to hear this lift up. If I didn't have these drops, you could still do this move without the drops. We're just going to use the drop today. So I'm going to bring my hand around. I'm going to isolate where that problem was, and I'm going to do a scooping motion. Tender. Mm-hmm. So that moved. Now I'm feeling a little bit right there. We're going to do it again. I'm going to lift her. Okay, better. It didn't clear it 100%, but it cleared enough to where I'm happy with that. So now what I'm going to do is I'm going to move down to the knee joint. So in the knee, what I want to do is we're going to grab it from underneath. So I'm going to grab the knee joint like this, and we're going to see if there's any fixation in either of those condyles, which where she's having a problem, it feels a little tighter. It doesn't feel like it's the main problem. The knee joint typically is going to be a joint that is going to be symptomatic in dysfunction in here or here. So this will probably ease up as we go to the foot. So I'm going to come back and check this, because I don't feel like it is the problem. It does feel like it is not moving, but I'm going to show you that in just a second. So I'm going to move back down to the foot, and then I'm going to go here. So I'm going to get the talus to move. I'm going to check it first. Yeah, and so her first metatarsal just moved. Okay. I'm going to go through all of the joints of the foot. I'm going to isolate her calcaneus. That was fine. Okay, good. Okay. All right. And okay, so let's do this. Let's have you lay face down, Holly. Okay. So what I'm going to do is I'm going to get that lateral portion of that knee joint. You can do it face up. I like doing it face down. I feel like you get a better adjustment. So what I'm doing is I'm isolating that tibia and I'm isolating that fibula. I'm using here as a fulcrum to push this way. All right, that was both fibula and tibia. That was awesome. Now, you have a little bit of fixation here. So what I'm gonna do, same thing. Holly, turn your head to the right and hold it there. I'm gonna pull you pretty aggressively. Okay. All right, so let's do this. Let's have you have a seat again. And we're gonna recheck our work. The problems are usually going to originate from here. Okay, and Holly, bend forward. All right, so you can see that it didn't go up, and so that's showing that that joint, that ilium, and that SI joint is moving. So you should post-check every adjustment. So what we did is by figuring out that problem, what we did is we went and we checked the spine, checked the SI joint, we checked the femur joint, the knee joint, and the foot. So the other things that you can do with this is you can check the rectus femoris. Most likely it's tight. You can get a muscle therapist, or you can get someone that dry needles, or the doc can do that. And also check vastus lateralis. Vastus lateralis is usually going to be the culprit, but the quad as a whole, and then psoas, iliopsoas, are also going to be tight because that's just what happens in the majority of the population. So the other things that you can do is you can activate low back, you can activate glutes, hamstrings, gastroc. Those are the other things that I would begin to look at if it didn't solve the problem. Most likely what I did is going to be very powerful, but it's not going to solve the problem. What I went over, it was very brief. It was not in depth in the sense of where my hands were. I have seminars coming up which you'll be able to access either live or on video, and it will give you the details of how to do that. Thank you so much. Please check out our upcoming seminar dates and then also other videos of how to adjust.